In the world of healthcare, information is everything. A patient's history, lab reports, medications, and diagnoses all form the backbone of treatment and care. But with information comes responsibility. Unlike financial data, healthcare data is deeply personal. It doesn't just describe your transactions or shopping history, it tells the story of your health, your body, and sometimes even your genetic makeup. This makes healthcare information one of the most sensitive forms of data in existence, and with the rise of digital technologies, from electronic health records, EHRs, to telemedicine platforms and AI-powered diagnostic tools, this data is constantly moving through networks, systems, and third-party providers. Now, imagine the consequences if such information falls into the wrong hands: identity theft, insurance fraud, blackmail, or even denial of medical care. That's why HIPAA, the Health Insurance Portability and Accountability Act, was introduced in 1996. HIPAA was not just another law. It became a turning point for the healthcare industry, introducing standards for privacy, security, and accountability that organizations must follow when handling patient data. Over the decades, it has evolved into one of the most influential regulatory frameworks in the world of compliance and cybersecurity. Today, we'll take a deep dive into HIPAA compliance, exploring its rules, requirements, real-world examples, penalties, and why it remains a cornerstone of healthcare data protection. Introduction. The origins and purpose of HIPAA was signed into law by President Bill Clinton in August 1996. Initially, the focus was not solely on data protection, but also on insurance portability, ensuring that employees could retain health insurance coverage when changing jobs. However, as healthcare increasingly shifted towards digital record-keeping, policymakers recognized the urgent need to secure medical information. Thus, over time, HIPAA expanded its scope, giving birth to specific rules around privacy, security, and breach notification. The law has two main objectives: administrative simplification, reducing costs, and standardizing electronic healthcare transactions. Protecting patient data, safeguarding protected health information, PHI, against misuse, loss, or theft. This dual nature makes HIPAA unique. It balances efficiency in healthcare operations with strong security and privacy measures. What is protected health information? PHI. At the heart of HIPAA lies the concept of protected health information, PHI. PHI includes any data that relates to a person's health condition, past, present, or future, is created or received by healthcare providers, insurers, or business associates, can be used to identify the individual. Examples include demographic details like name, date of birth, and address, medical record numbers and insurance policy details, lab test results, prescriptions, and doctor's notes, billing and payment records, even biometric identifiers such as voice prints or fingerprints. If it connects a health condition to an identifiable person, it is considered PHI. Fun fact: HIPAA covers both electronic PHI, ePHI, and paper-based or verbal PHI, though the security requirements are most stringent for ePHI. The core rules of HIPAA. HIPAA compliance is structured around several key rules. Let's go deeper into each. 1. The Privacy Rule, 2003. The Privacy Rule establishes how PHI should be used and disclosed. Minimum necessary standard. Organizations should only use or disclose the minimum PHI required to achieve the intended purpose. Patient rights. Patients have the right to access their health records, request corrections to inaccurate information, obtain a record of disclosures made about their PHI. Disclosures without authorization. HIPAA allows PHI disclosure without patient consent for treatment, payment, and healthcare operations. However, for marketing, research, or sharing with third parties, patient authorization is mandatory. 2. The Security Rule, 2005. The Security Rule specifically addresses electronic PHI, ePHI. It introduces safeguards across 3 layers: administrative safeguards, risk assessments and regular evaluations, workforce training and sanction policies, contingency planning for disasters, physical safeguards, facility access controls, who can enter data centers. workstation use policies, device and media controls, disposing of old hardware securely, technical safeguards, unique user IDs and multi-factor authentication, automatic log-off from systems, data encryption during storage and transmission, regular audit logs and monitoring. 3. The Breach Notification Rule, 2009. Introduced after the High-Tech Act of 2009, this rule makes breach disclosure mandatory. If PHI is compromised, the affected individuals must be notified within 60 days. Breaches affecting more than 500 individuals must also be reported to HHS and the media. Smaller breaches, 500 records, must still be logged and reported annually. 4. The Enforcement Rule. This rule governs investigations and penalties. The Office for Civil Rights, OCR, enforces HIPAA, investigating complaints, conducting audits, and imposing penalties. Who must comply with HIPAA? HIPAA applies to 2 categories: covered entities, healthcare providers, hospitals, clinics, pharmacies, dentists, health plans, insurance companies, HMOs, Medicare, Medicaid, clearinghouses, intermediaries that process claims or billing data, business associates, vendors who handle PHI on behalf of covered entities. Examples: cloud providers, billing companies, IT service providers, legal consultants. HIPAA requires business associate agreements, BAAs, to ensure shared accountability. This extended scope ensures compliance is maintained across the entire healthcare supply chain. Why HIPAA compliance matters. Let's break it down into 4 pillars: legal and regulatory compliance. Avoid hefty fines and penalties. Stay aligned with federal laws and healthcare regulations. Patient trust and reputation. Trust is the foundation of healthcare. Breaches erode credibility. Cybersecurity defense. Healthcare is a prime target for hackers. PHI is worth more than credit card details on the dark web. Operational excellence. HIPAA promotes standardized procedures, reducing inefficiencies, encourages secure adoption of new technologies like cloud storage and telemedicine. HIPAA compliance checklist, expanded. For organizations, achieving compliance is an ongoing process, not a one-time event. A comprehensive checklist includes conducting regular risk assessments, developing policies and procedures for PHI handling, implementing role-based access controls, encrypting PHI both at rest and in transit, training employees on privacy obligations and phishing risks, preparing an incident response plan for breaches, maintaining audit trails and monitoring systems, signing BAAs with every vendor handling PHI, conducting periodic compliance audits to ensure ongoing alignment. Penalties for non-compliance. HIPAA violations are taken very seriously. Penalties are tiered. Tier 1, organization was unaware of violation, $100 to $50,000 per violation. Tier 2, reasonable cause but not willful neglect, $1,000 to $50,000 per violation. Tier 3, willful neglect corrected, $10,000 to $50,000. Tier 4, willful neglect uncorrected, $50,000 per violation, up to $1.5 million annually. In addition to fines, violations can lead to criminal charges for intentional misuse of PHI, lawsuits from patients, and severe reputational damage. Anthem Inc. breach, 2015. Hackers stole data of nearly 80 million individuals. Settlement, $115 million. Root cause, failure to implement adequate cyber hygiene measures. MD Anderson Cancer Center, 2018. Lost unencrypted USB drives containing PHI. Fined $4.3 million. Lesson, encryption is not optional, it's essential. Primera Blue Cross, 2019. Data breach exposed 10.4 million records. Fine, 10 million settlement. Highlighted the dangers of not addressing known vulnerabilities. Telemedicine and remote care. HIPAA compliance must extend to video consultations and mobile apps. Cloud storage. More data is stored in third-party environments. Vendor management becomes critical. AI and machine learning. Data-driven diagnoses raise new privacy questions. Wearables and IoT. Devices like smartwatches track heart rates, sleep, and even glucose levels, creating new categories of PHI. Regulators are expected to strengthen HIPAA rules to adapt to these challenges, especially around cybersecurity resilience, interoperability, and patient consent. To sum up, HIPAA is more than just a compliance framework. It is a commitment to patient dignity, privacy, and trust. For healthcare organizations, compliance is not optional. It is the very foundation of safe and ethical healthcare delivery. For auditors and IT professionals, HIPAA provides a structured framework to evaluate data security, identify risks, and enforce accountability. Because ultimately, protecting patient health information is not only about avoiding penalties, it's about protecting lives and ensuring trust in the healthcare system.